The main reason for thinking about running this seminar now really was prompted by something we're going to be doing in a week and a half's time, which is that the social value engine for the second year will be exhibiting at the LGA conference. And it led us to think about what the key hot issues are currently, not just around local government, but more widely. And the big issue that a lot of colleagues in England, and it's great to have people from, I think, all four of the UK countries on this session. So this isn't just about local government in England, it's much more broadly about social value. And I think people joining us from those other settings will get a lot of learning and benefit from listening to the speakers. But the big issue that's really landed at the heart of a discussion at the moment in local government in England is the whole local government reorganisation process, and all those places that are still what we would call two-tier. They've got district councils and county councils are going through this evolution where effectively they've got to redraw their boundaries and group into unitary authorities, and also some smaller unitary authorities that were already well established have got to think again about the size and scale of what they do. And this has become a very significant process. I mean, redesigning local authority boundaries is never an easy thing. What it's led to is a lot of discussion about what a local authority should look like. But what's missing from that debate, it struck us, is a discussion about social value and social impact. It may be implicit, but in all the guidance and the other things that have come out, it's not explicit. And we think it ought to be more explicit because we think it's really important. Sorry, if can you go on to mute, please, if because we can hear one or two people. So what I did in assembling this panel, and anybody that's coming along to the Local Government Association conference in Liverpool on the 1st, 2nd and 3rd of July, we'll have a stand there. We've got bags and biscuits and things. You're very welcome to come and see us for a more detailed chat. But in assembling this panel, I thought about the key aspects that have cropped up in the discussion about the future of local government more broadly that we've been involved in looking at impact through the lens of social value in relation to. And that's why I've assembled this panel of key speakers. And so we've got Jodie, who's going to kick us off and talk about things from a procurement perspective. We've then got Claire from East Riding of Yorkshire Council, who's going to talk to us about their experience as to where things are currently and the way social value is featuring in their thinking about the reorganisation agenda. One of the things that I think isn't as well established in the future templates going forward is the role of civil society in the voluntary and community sector. And whilst Cheshire isn't directly impacted by these things, I was delighted that Mark Redding is able to join us to talk about that whole agenda, because he's done some really cutting edge stuff with the two well-established unitaries there that I think are important and that we can learn from. Then you've got the whole prevention agenda around health, and my good friend Katie is going to talk to us about some of the work that's gone on in Lincolnshire around measuring the impact of prevention and how that's important. And I think that is really interesting in the context of the future of local government, because one of the big issues that we face is burgeoning costs around social care. And so Katie will talk about some of that. And then, you know, the final bit of the jigsaw is how you visualize, communicate and engage people in that whole process. And I know of nobody better than James Turner, who's worked with me actually in the fiery furnace on looking at some of these issues in Leicestershire, to talk about how you can visualize through dashboards and other activities some of the key issues you want to use when you're looking to measure the impact of things. So, as I say, we're not a one-trick pony in this seminar. We're not only thinking about what's happening in England, because, you know, the social value engine and our mission has been, well, global, but we've worked across the whole of the UK for a long time, and I was really delighted that there are people from other countries who are at different stages of development in terms of this agenda and other aspects of social value who are able to join us. So whilst the core theme has stimulated these speakers, it's not exclusively about local government review, and I'm very pleased others have seen that and come along. So what we're going to do is each speaker's got 10 minutes. I'll introduce each of them. They'll run through their presentation. Please drop any questions you've got in the chat, and if there's anything really pressing that's really struck a chord with you, we'll give a little bit of airtime for you if you want to speak about that immediately after the speaker's finished. Don't interrupt the speakers, please. I know you won't anyway, because you're all very polite, I'm sure, but there will be a bit of time at the end to respond to anything immediate, and then we're going to group things and have a more formal sort of run through, a bit of a Q&A at the end, and we should be finished in 90 minutes or a little bit before. So we're just about ready to go. Before and I can't see absolutely everybody, but Maddie is monitoring things. Before we plunge in, if you raise your hand, if there's anybody who'd like to ask any fundamental foundational questions or has any queries just before we start, or if there's anything that's not clear. So if you do that now, and I'll give you 10 or 15 seconds, but if not, we'll then jump into asking Jodie to lead us off with the presentations. So I'll just pause for a second to see if anybody's got anything they want to raise before we start. Looks like we're good to go. Okay, right. So if I could hand over to you then, Jodie, and talk to us about procurement.
Perfect. Right, I'm just going to share my screen and hope it works. Can you all see that? Perfect. We're off to a good start. So yeah, thank you, kind of Ivan and the Social Value Engine team for kind of inviting me to speak today. I'm the Social Value Support Officer at YPO, so in my role, I support the development and the implementation of YPO's social value and sustainability strategies, with a large part of my role focusing on implementing social value and sustainability into procurement, ensuring that the impact can be measured and monitored. And today I'm going to cover a bit about that, the importance of implementing it, and kind of where YPO are in our journey. So I guess first, who are YPO? You might not all know who we are. So we're a public sector buying organisation, and last year we celebrated our 50th year. We are 100% publicly owned by 13 local authorities, and social value is part of our ethos. Our business model and the way we operate demonstrates our commitment to social value. We save the public sector money and we reinvest our profits back into the public purse. We do this through dividends and loyalty vouchers to help budgets go that little bit further. So procurement in a changing landscape, and I'm sure anybody in procurement probably knows all these, but as a public sector buying organisation and any kind of local authorities in procurement activities are influenced both directly and indirectly by various national regulations and procurement policy notices, with the most notable change this year being the Procurement Act coming into force in February and the updated social value model. So I guess, what does this change mean? This means that procurement organisations and councils now need to be shifting the focus in procurement to social, economic and environmental impacts rather than just price, and considering what your local priorities are and how we can measure and monitor this impact. So embedding social value in procurement has the ability to transform spending and create positive change. And at YPO, we're quite, I'd say, still quite new in our journey. We have implemented several things to improve social value in our procurements. So we've now gotten a dedicated in-house social value team to support the strategy, implementation, delivery, and recording of social value. To provide more strategic direction, in 2020, we launched our responsible procurement policy, which defines how we will approach embedding economic, social and environmental requirements into our procurement activities, taking both external and internal priorities into account. So on the screen now, you can kind of see our 6 priority themes for social value and procurement. These were developed in line with our social value strategy, our customers' expectations, and by models such as the social value model. So I guess to give like a quick example, an example outcome for good jobs with skills and development and training would be any kind of creation of new jobs in a local area, including jobs for people from disadvantaged backgrounds. And then a big one is an example outcome of growing strong, safe and sustainable economies and supply chains could be the engagement and growth of SMEs. So the amount we're spending with SMEs, the amount we're using on a certain framework. So really key topics. These themes are embedded into all stages of our procurement process. And we've also enhanced our market engagement to really understand what our suppliers are capable of, especially SMEs and VCSEs. And we also engage with our customers to understand what their local priorities are and to see how our frameworks can support meeting them. We recently increased our minimum weighting for social value / sustainability in our procurements to 20% to continue meeting the needs of our customers and local communities. We've also recently, with big help from Social Value Engine, implemented social value commitments into our procurements. This allows us to measure and monitor social value delivered by suppliers. And during the tender process, 3 to 6 measures / proxies are identified and suppliers are required to state a volume or amount by which they commit to delivering during the framework / call-off contract. So a key element for social value and procurement is how we keep it accountable and how we're transparent and how we ensure that it's not just a tick box. So to ensure that the social value being delivered by us as YPO and our suppliers is real, measurable and impactful, we do a number of things. So we utilise Social Value Engine to provide our social impact and social return on investment. And then we can share this internally with our colleagues, board, SLT, and we also share this with our owning authorities and also our customers and suppliers. We also utilise Social Value Engine to track and monitor suppliers' social value commitments delivered. This is a great way for us to see what they're delivering, to see where the impact is, so what location it's in, what theme it fits under, and also to improve our visibility in social value. It's completely embedded in our contract management process to ensure commitments made during procurement are delivered in practice. And this also provides suppliers with an opportunity to share any additional social value they have delivered. In the conversations, we normally find that they've delivered something and they don't realise it's social value. So opening up them conversations really helps us dig out what they've delivered. And also it's an opportunity for our suppliers to raise any issues they're having, if they're struggling meeting the commitments they've made, or if they're struggling with anything on the framework in general. So as an organisation, we made the decision for social value commitments to be unscored. So this decision was made to reduce the barriers to SMEs and also to allow the shift to be deliverable and accountable rather than suppliers over-promising for competitive advantage. So we didn't want suppliers saying they could deliver the world and then once they're awarded on the framework, delivering nothing or not as much as promised. So by having it unscored, it became a way of them telling us what they could actually deliver. But although it's unscored, the social value commitments become contractual. So once awarded onto our framework or awarded a contract, the social value commitments become part of your KPIs. So these are reviewed and monitored, and as mentioned before, these are embedded into the contract management meetings. So I guess in summary, what I'm trying to say is social value is no longer optional. It's expected, and if embedded early and managed in procurement, it has the potential to create long-lasting impacts for local communities. At YPO, we're still very early in our journey, and we continue to monitor our progress and also continuously look for improvements and ways we can better manage and measure our social value. So yeah, I guess that's all from me. I have no idea how I did on time, but if anybody has any questions, I'm kind of happy to answer them, or if you want to ask at the end, that's fine. I've also included our website on there and also our social value email address if anybody has any questions after this session.
Thank you very much indeed, Jodie. That was almost bang on time, so you've done very well there. If there are any immediate comments or questions, if people would like to pop them in the chat, we can have a look at them now. But if you've got something you want to save till later, keep that up your sleeve for now. What I think is really interesting, and I made a note of two key things there, is the increasing level of weighting that's being given to social values at 20% now, which is significant, and also the fact of getting people to formally enter into a measurable commitment to that, which becomes then part of the contract. And I think those two things are really important if you look at them through the lens of what a good local authority should be doing. I mean, I think it would be interesting, Jodie, literally for a minute, perhaps before we move on to Claire, just to explain a little bit more about the structure of YPO, so people have got a sense of how you work, because you work on behalf of a very big collective of local authorities, don't you?
Yeah, so we have 13 founding members, but then we have multiple other local authorities that are members or have an impact on YPO. And also, I think a lot of people think we're just like a Yorkshire-based company where we operate nationally. And we also have multiple products and services. So we do public sector as well as education. So yeah, it makes measuring social value and procurement a little bit harder. But yes, probably a very unique makeup as an organisation.
And what I think is really interesting in terms of thinking about the future of local government is that collaborative model is the kind of thing that it's easy to miss when you're being forced down a relatively obsessive route of needing to justify your boundaries and thinking about some of those very fundamental things. And I think, like social value is a theme more widely that I think should underpin the way people put their proposals forward. The whole collaboration agenda in local government, you're an exemplar of that as an organisation, is something which merits more work because I think it drives out social value. So, right.
Yeah, I agree.
Well, thank you very much, Jodie. Much appreciated. I think you can stay to participate as we go along, can't you? So that's lovely. Yeah. Thank you very much. Right. Well, I'm going to change the focus slightly now and move on to Claire, who will give us a slightly different perspective on the whole agenda. And she's going to do that in 10 minutes. She's pretty focused, so I'm guessing that she will manage to get that done in the 10 minutes, but we've got a bit of latitude if she wants to talk for a bit longer. Anyway, Claire, over to you.
I'll do my best. So hello, everyone. I'm Claire Watts. I am the Director of Economic Development and Communications at East Riding of Yorkshire Council. We've been working with Ivan for at least 10 years now in terms of looking at measuring impact and doing that predominantly through social value engine developments and deliveries. I'm going to mainly talk kind of more about how we've embedded measurement of impact into some of our funded programs, but just to say, kind of moving on from what Jodie's just said, so we have been working hard over the last few years to work much more closely with our procurement team in terms of how they embed social value measurement into what we do as a council. We've recently expanded our social value team to include a social value coordinator, impact coordinator, because what we recognised was, as Jodie mentioned, I think at the beginning, that we had lots of people making commitments around social value and then we weren't cashing them in. So the impact coordinator's job, in effect, is to support teams where they've built social value into their contracts to make sure that we get it in terms of what they then deliver. And James is going to use the overall dashboard of our social value as part of what he talks about. So you'll see kind of that we capture both social value from programs and social value from procurement activities into kind of an overall dashboard of the social value that we're delivering as a council. So hopefully that will be interesting to people, and I'll be around in Liverpool with the team on the Wednesday and Thursday if anyone's there wants to come and talk specifically about kind of what we do and stuff. But moving on, what we've tried to do for quite some time now, so we started in the EU funding programme 2014 to 2020, and trying to systematically measure social value through all the projects that were delivered through our community-led local development programme in Bridlington and Scarborough. So that was our first kind of systematic trying to capture social value and to upskill all the project leads in terms of how they did that, and so that they ended up with an impact narrative at the end of the process that allowed them to kind of, you know, explicitly say what it was that they did and where their value lay in terms of future funding bids and the like, because what we wanted them to be able to do was to go and get money from other people, not just from us, and that's relatively successful in terms of people having that better narrative about impact and value. I'm going to start by talking about our Do It for East Yorkshire Community Fund. So I'm just going to share my screen now. Hopefully you can see that. So this is the overall impact card for the Do It for East Yorkshire Community Grant Fund, running from April 23 to March 24. And by measuring the impact kind of across the whole programme, what that's enabled us to do year on year is put a case to our elected members to say, this programme is really impactful, please can you put some more money into the pot. So we had money last year, and we've for 24-25, and we're working on the impact for that at the moment. We've now got money for 25-26, so it really helps us in terms of kind of looking at that. So this is the cumulative stuff. We like these impact cards. It gives people something to grasp onto. If you can't have a picture of someone sitting on a straw bale, you're probably not doing things right. But what we found across the programme is that for every £1 we invested, we returned £5 in social value. So that's a really good return. But just the numbers, in terms of the numbers of volunteer hours and the number of people benefiting, just are really compelling in terms of sort of saying what's happening. Let's move this on. It doesn't want to move on. Let's do that. So here's some of the individual projects then that were sort of delivered through some of our programs. This is kind of levelling up fund activity. So through Love Your High Street programme, which was the kind of COVID recovery kind of elements of programmes. So a number of projects, a picnic area, so some environmental and community benefits, a big stage roof, which enabled far more community activity to happen in Withensea, which is an area of fairly significant deprivation, and Beverley Festival of Angels, which was part of the town's kind of Christmas events and activities that brought lots of people in, and the number of people who visited that activity was really quite significant. So the type of project, so each project has its own independent evaluation, and then we can accumulate that up, and we can also look at kind of additional benefits by delivering things as programs. So particularly in the element, the example of community-led local development, where one of the ways of doing that is to have a local board who are making decisions about how money is spent in their local area. There is social value delivered through just the manner in which the programme is delivered, as well as the individual projects. So this kind of approach allows us to capture both of those things. This is one that's kind of going on at the moment. So this is more of a skills-based programme. It's delivered through Gould Town Deal, which is one of the government Town Deal programmes, kind of coming to a conclusion next year. And again, this kind of is a programme where you've got individual people with access to training, employability support and the like. Everybody will be delivering these kind of programmes. This is just one example. But if you've got a kind of, you could look at it in the context now of you Get Britain working plans, for example, in terms of a way of kind of embedding impact measurement into those kind of programmes and then looking at the overall economic value of that. So that's that programme. I think I've got one more. I do. So this is some of our own money that we've invested, and it's stuff that's come through the Household Support Fund. So this is about how we support our kind of organisations that work together in terms of tackling food poverty. So predominantly food banks, there's a hygiene bank in there as well, community pantries, social supermarkets, those kind of activities. Two schemes that kind of run through those. One, the larger on the right, about an assistance grant for food and essential supplies. We've been running some kind of emergency assistance grant for food and essential supplies since just before Brexit, because the first scheme was set up in case there were significant food shortages, and that kind of exacerbated issues for people in food poverty. We then moved into doing something similar during COVID. We then moved on to doing something through the cost of living crisis. And we continue to do so. So we can look over time as we've got kind of better at what we do, and the members of the Food Poverty Alliance have got better at what they do in terms of how doing that happens. And we've in the more recent years also had a white goods fund. So it's not just about food, it's about kind of crisis where people haven't got kind of equipment to cook or wash or whatever, that we can assist people to take stuff. I can see a question coming in about forecasting. Absolutely. We forecast what we expect a programme to receive, and then we measure against it. In terms of stuff, we don't use it in terms of investment decisions, though. So the question in terms of if projects get low numbers and haven't received investment, no, we haven't used it in that way. My view is kind of that each project is comparing itself against itself. So we'll have criteria for funding that if projects meet those criteria and receive money, and then we would be looking to how they would improve that. So if they projected, or we forecast from their application, that they were going to produce a certain level of social value through their programme, and then they didn't, there's an ongoing question. One is, did they create different social value to what we were predicting? Because that quite often happens, where things don't quite do what you expected them to do, but they do something else, which is, in social value terms, potentially equally or more valuable. Or are there ways that they can do things that could be done differently? Predominantly, a lot of these funds are different. So the first one, the Do It for East Yorkshire Fund, we don't look to fund the same organisations for the same things over again. It's a kind of about generating activity and supporting things to start, and then we'd potentially expect them to get money from elsewhere if they wanted to carry on that activity. Whereas these ones are ones that we kind of continue with similar organisations for the same kind of activities, and therefore we can see a growing expertise and experience in terms of delivering the best value for their best beneficiaries that it possibly can. I don't know if hopefully that helps. And I haven't got a slide because we haven't done the work yet, but just to say we have, and it might be of interest to people, embedded the same kind of approach into all our shared prosperity fund activity. So that's something in terms of kind of as you move into devolution and combined authorities take on shared prosperity and you're trying to make a case that your approach is good. That's our intention in terms of having some really kind of systematic impact measurement. We've had the measurement, we just, because we haven't got all the results yet, we can't produce the reports. We know that, for example, our interim results are that for the communities in place element in year 1 of shared prosperity, we delivered a social return on investment of about £3.77 for every pound investment. So a similar kind of level of as we'd expect for those kind of community-based programs. Some things will be higher, some things will be lower. So yes, that's where we're at. So we embed it, we measure it, we talk to people about improving delivery and collection, because sometimes it might just be that people are delivering brilliant impacts, but they haven't worked out how to measure it yet. So there's a whole job there in terms of supporting and helping people to do that as well, and increasing kind of people's experience and expertise, both within the council in terms of the activities that they're doing and externally where we're working with particularly voluntary community sector organisations. So that's me. I've tried to answer the question that came up. I don't know if there's any other immediate questions.
Thank you, Claire. If there are any other immediate questions, people need to furiously type them into the chat. I think you just building on what was said by Jodie, increased social value weighting, increased social value commitment, embedding, which is the big thing that comes out of your presentation. I do think the landscape, and it's taken a bit of a while since the 2012 Act, effectively nearly 15 years, but the landscape is starting to change quite significantly now in terms of people taking this stuff seriously, and I think it does need to be a key design feature of thinking about what the future of structures will look like. I like the question from Jess about forecasting, because I actually do think using social value as a tool, projecting impact is very important. I can see all the reasons that you give as to why we wouldn't want to just slavishly do it, but I've been working with the Scottish Government on the community-led local development programme across 19 local authorities, and looking at the results from a big programme, 590 projects like that, it really does beg the question about scope to sharpen up the forecasting element, and thinking about if we can make it work robustly, how it can become a project assessment tool as well as an evaluation tool. But anyway, very interesting, and starting to build a theme. I'm now going to move on to Mark. So we're moving from the east and centre of the country to the west, and I'm going to invite Mark to give us his 10 minutes about his experience from a voluntary and community sector role of working with local government and in wider partnerships around social value. So over to you, Mark.
Good afternoon. I'm just going to share my screen. I've got some slides. They're not as pretty as everyone else's, though. They're more to help me. 1 second.
Yep, it's coming up.
Okay.
There we go. Yeah, we got it there, Mark. That's great.
Yeah, you can see that. Brilliant. So my name is Mark Redding. I'm the Chief Exec at Cheshire Community Action. For those that don't know, Cheshire Community Action is a rural community council, third sector organisation, or in English, a registered charity. We cover the Palatine of Cheshire, which is actually Cheshire and Warrington, 3 unitary authority areas. We support community buildings. We run a rather large hospital discharge project. We've got a social enterprise consultancy. We do community engagement. We've got a growing spaces network. We manage grant schemes. We do housing needs assessments, and we're heavily involved in neighbourhood planning to kind of flavour of the type of work that we do across Cheshire and Warrington. Some broader kind of societal context then. We're living through a time where every penny is scrutinised, whether you're a council employee, funder, or part of a third sector organisation. There's more demand for everyone's services, fewer resources, and lots of pressure on all sides. But in the middle of that, third sector organisations, that's the voluntary, community, faith and social enterprise sector, are still out there doing the work that we do, supporting people, responding to social need, both old and new, building trust in places that statutory services often can't reach. We're not just filling gaps either, we're often the glue that holds it together, or a key driver behind organised community action. Here's the challenge though, being trusted isn't always the same as being listened to, especially when decisions are being made. And that's why, from our perspective, impact management matters. Historically, I'd argue that smaller organisations, third sector organisations, have not been very good at impact measurement and demonstrating the great work they do. Mentioned it before, councils, the NHS, statutory partners have got less money, demand keeps growing, and the third sector step in, helping people stay afloat, stay well and stay connected. We're trusted on the ground, but often too ignored in strategy rooms. As a result, we need to show our impact, demonstrate that better, not just to prove we're doing good work, but to stay involved in shaping what comes next. At Cheshire Community Action, we support a wide range of third sector groups across the borough, from small rural projects, community buildings, all the way to borough-wide services. And in recent times, we've been able to clearly show our impact. And I'd argue as a result, it's opened doors, it's secured match funding for some larger projects that we deliver. We've won new contracts as a result of being able to demonstrate our impact comprehensively and respond to challenge. And we've built trusted relationships as a result with public sector colleagues, both across East and West Cheshire. One example of one we're particularly proud of, and that's a community-led care commission. It's a 2-year grant-giving programme broadly aimed at neighbourhood level health and well-being. And over time, over the last 2 years, we've gathered detailed data from grantees, carried out impact assessments, greatly utilised the social value engine and the analysis from that to understand not just what's being delivered, but what's changed for individuals, for communities, and being able to look at that in context of the local system as well. That evidence has been used to reshape the next phase, which will be starting in January. So we've used all of that learning and data to focus the grants more sharply on reducing health inequalities, introducing more flexible models like person-centred support, prioritise neighbourhood-led ideas and built in simpler, more meaningful reporting rooted in social value. So we've done both the social value and the value for money elements and then present a work to the local authority in analysing that data to see where the best value was had. So it's not just about giving out money though, it's about using that insight from all that data that you have access to evolve the system to what works locally ultimately. Impact in our world doesn't always look like it does on a spreadsheet. The quiet conversations in a village hall that stop someone from reaching a crisis, the third sector flexibility that always goes beyond what the contract says, and I could give many examples of that, because the need is right there in front of you. It's the trust that helps you spot things early and act on them. And we've used tools like the social value engine to help quantify that broader impact from our interventions and projects, especially where stories aren't alone, and where funders want figures in being able to measure things. I'll give you another real world example. Shavington Village Hall, Shavington cum Gresty Village Hall, we've worked with them to understand and evidence the wider social value of their community space ultimately. So what looks like a booking on paper in reality is a lunch club, reducing social isolation, a warm hub, keeping people safe through winter and socially engaged, a space for early years groups, community exercise and peer support. The social value engine helped us translate the activities that take place in that space into outcomes that funders recognise: health gains, carbon savings, economic uplift. And it gives credibility to what we already know is true in terms of the value of a community space. The people that run the space just viewed it as that, and we've been able to demonstrate to the people that work in and around the community building as well that it's just so much more than just a room for hire. So what works for third sector groups? There's no silver bullet, but for us it's a mixed approach, combining outputs, what we do, with the outcomes, what changes. We add in stories and quotes from people to bring our work to life. Use social value tools like the social value engine to show the broader impact. Validated surveys, again, to feed into that kind of impact process. Keep it simple and relevant. Choose what fits for the groups that we're working with. And we make sure it speaks the language of the people making decisions, ultimately. There are challenges. Funders want different things. Small groups can't keep up with complex reporting, and some tools that are out there are technical and abstract and aren't a real good fit. And there's also the fact that sometimes we're not seen as key partners, but that's why it's really important that we frame our impact on our own terms with the tools and evidence that reflect what really happens in communities. What do we need from the system? We need to involve third sector groups early, not just at the end of a design process. Use shared approaches to measure an impact. Keep them flexible and let communities help decide what gets measured. I'm glad Ryan's here on the call today, because in West Cheshire, we've got something called the Local Voices Framework, which was led by Cheshire West Voluntary Action. That's our area's CVS equivalent. It was built with local third sector groups and experts by experience, lived experience. It's easy to use and adapt, and it supports the social value engine and other forms of social value evidence as part of the bigger picture. The Local Voices Framework lets us gather meaningful insight from end users without overwhelming small groups, and it puts that kind of lived experience, community voice at the heart of evaluation. It really complements the social value engine really well. Final thoughts. Everyone's under financial pressure all the time. Partnerships, for us, partnerships are more important now than ever, and that's partnerships both within the sector and with the local authorities. We need to share data and insights, not just outcomes. Try and align around what matters to communities by talking to your communities and engaging with them, and use tools like the social value engine to make the case for prevention, place-based work and local solutions. The system works better when we understand each other's constraints and when we recognise each other's strengths. I think that's it. I don't know what it was like for time, Ivan. I can talk quite quickly, but hopefully it wasn't too long.
I found that, without embarrassing you too much, inspirational, Mark. That was fabulous. Not that the other two speakers weren't as well, but that was really, really good. I'm just going to say a couple of things, but I just wonder before we do that, if there's anybody that wants to raise anything immediately arising from Mark's presentation, if they want to pop anything in the chat. Just whilst we're waiting for that, I mean, I feel that we've got a golden thread emerging here. So we've talked about via Jodie social value weighting, social value commitments. Claire was all about embedding and demonstrating how, you know, an enlightened local authority can build this. What you've gone on and taken us to see is the role that engagement has to play, and also how important social value can be in the context of delivery. And there were three real things that struck me from what you said. The first was trusted, not heard. And I think social value, if it works well, can become a bridge. And then you had this wonderful phrase, gives credibility to value that we already knew was true. And I think that's often been the challenge. We know we do good stuff, but how do we put something meaningful on it as an example? And then the final bit, which I think is really important in breathing real life into this notion of co-design, is framing our impact on our own terms, not being part of an uneven relationship. So I think some real sort of pithy, powerful stuff coming out of a presentation about the realities of delivering social value as a third sector organisation. Okay, and you've got a nice comment there from Katie, who is the next speaker. So what I'm going to do, I think, is move on to Katie and ask her to take us on her journey around health and prevention. Katie.
Thank you, Ivan, and thank you to our previous speakers as well. I'm setting the tone. I'm just going to share my little slides. Hopefully this will work. Well, the engine.
Yeah, it's coming up. Yeah,
something's happening. Good.
Yeah. Oh yeah, the little people about. I love these folks.
Yeah,
just incidentally, I love these little drawings. But anyway, yeah. Sorry, Kate.
That's quite all right. Thanks, Ivan. So I work as part of a multi-agency team called the It's All About People team in Lincolnshire, and but I'm hosted, and my background is very solidly voluntary and community sector, and so my employing organisation is Lincolnshire Voluntary Engagement Team, which is a network of voluntary community sector, faith sector organisations, social enterprises with a particular interest in health and well-being, and LVET is the network that really supports that engagement of the sector within health and social care and within that kind of statutory space, if you like. And so the It's All About People team, we champion person-centred ways of working, strengths-based approaches, personalisation as an approach. And so our real focus with social value has been the so what of all of the numbers, the measuring what really matters. We know that health and social care systems and a lot of what community sector organisations end up measuring are the kind of numbers, the bums on seats, the kind of how many people have you had through the door, all of that sort of stuff, which is fine. But a lot of assumptions are often made about that. And one of the things that happens either is the assumption that more is better, or in some cases, in terms of health, more is worse, as in attendance at A&E. So in terms of, it's often increased demand or whatever. So it's, and for us, it's just, well, it's not that simple, is it? So what about that experience for people? What impact does the experience of trying to access a service or accessing a service or an activity actually make to that person? What really matters? What impact does it have on their quality of life? What difference does it make? And actually trying to understand, if increased demand actually, is it a reflection of services not meeting people's needs in the right way at the right time? And actually, if we got better at that, right thing first time, might we see a reduction in demand, that kind of thing? So, and what do the services look like that do meet people's needs at the right thing at the right time, and therefore potentially, the motivation, I think, for health and social care is how can we sort of, prevent problems escalating to crisis point and then being, difficult in terms of, and expensive for the money people within health and social care. So we've that's quite big, but we've had a couple of projects where we've tested out using the social value engine to try and explore some of this stuff. So we're measuring in certain projects, starting to measure what really matters. What difference is the service making? One of those projects is social prescribing. So for those people that don't know, social prescribing is a way of connecting people to community-based support. It's usually funded through health. So in Lincolnshire, we have social prescribing link workers in primary care, but also in the world of mental health as well. And those link workers are not medical, they are not clinical people, but they are the people who can have time and can have a meaningful conversation with people, ask them what matters to them, help them set goals and connect them with wider services and support, the kind of support that impacts on the wider determinants of health, like, you know, your stress factors, whether you're in employment, your financial situation, all of that sort of stuff, things that impact on health. And then we also have piloted social value, working with a programme called Living with Cancer programme, where there again is a sort of coordinator support to help people to address not just their sort of clinical treatment pathway, but also actually what does life look like when you're living with a cancer diagnosis, and, you know, of their wider kind of support services that you might need.
I don't know, Katie, if you're moving the slides on, but they're not moving on the screen.
No, not
it
yet.
Doesn't matter
I am
if
now.
you don't. Okay.
So hopefully that's moved on a little bit. So in terms of social prescribing, we looked at the outcomes that were already being measured within social prescribing. So these are user self-reported outcomes. So people who've used the service, these are the things that they started saying. So in the left-hand column, it's things like, I have accessed a new service, I feel more in control, my mental health has improved, my physical health has improved, I've begun volunteering, I feel more involved in my community, I found work, those kinds of things. And then we also wanted to measure something that commonly came out was not a user reported outcome, but something that was reflected in the way the service was delivered in partnership, but the value of that collaboration with other organisations and connectivity between organisations, recognising that this isn't something that happens in isolation with just one service. And that was the approach we took within the social value engine, which was the tool we chose to use for this. We then link those outcomes to particular proxies within the social value engine, which are the things that help to generate some of those impacts that you've seen on other people's slides today. So the kind of, you know, for every £1 you spend, you get this amount out. This is where the proxies come into their own, really. So the key really for us was trying to find ways of the outcomes that we wanted to see, and what are the relevant, you know, financial proxies in the social value engine that really kind of link to those outcomes, and give us some reasonable data around the social value of that improvement or that change or that difference that we've made. So in terms of the social prescribing programme, we had 11 of the primary care networks in Lincolnshire. So there were 14 primary care networks, so 11 of them took part. And these are the kind of headline social return on investment figures broken down by PCN. But an average across those PCNs, it ended up showing that for every £1 invested in social prescribing, so that's in the link worker time and the on costs, it generated an average of £3.73 of wider social value. So that covered things like, you know, what that meant in terms of people being more involved in their community or improved mental health, etc. But as you can see, there's quite a range in terms of how it impacted in different primary care networks, ranging from sort of £1.96 right up to sort of, I think the highest was something around £5. Yeah, in First Coastal it was £5.86 per pound invested. Quite a lot of variation, and some of that was due to data quality and kind of the number of sort of outcome measures that were available to sort of put through the social value engine and things like that. And the difficulties of gathering that kind of data consistently really was one of the things that came out of this programme. And then in terms of the Living with Cancer programme, we took a completely different approach with that, and that was really around and it involved some close work with Ivan actually, in terms of analysing individual case studies. So it was less about outcomes measured across the whole programme and aggregated. It was much more about looking at individual case studies and people's story. So just an individual person's story and their journey, and what that then might mean for social value. And for the Living with Cancer team, I'm not expecting you to read the bits on the right hand side. That was just a snapshot of their wider dashboard and the kinds of where they wanted this to fit within all of the other things that they were trying to measure around the Living with Cancer programme. And so this was just one tiny part of a much bigger kind of data collection methodology that they'd put together. And so the key thing for the Living with Cancer programme really was that it was their one element of trying to measure the what difference did it all make. So the dashboard was a lot of figures about, you know, who did what, when, and all of that sort of stuff. But the so what part was what they were trying to capture with this. The 8 case studies that were focused on, there were a number of challenges in identifying accurate input costs and having consistent information on the outcomes, the what difference it made. But there were some really meaningful things identified out of that in terms of the suggested social value, the social return on investment for the service as a whole, with a lot of things adjusted, but came out at sort of £8.95 per patient. So there will be more work needed in terms of refining this approach. And that's something that we're coming on to next, really. So I just wanted to also share a few highlights in terms of some of the challenges and enablers that we've found using this approach. And as I've mentioned, one of the things are getting accurate information on the input costs. So it's easier, we've discovered, if you've got a specifically funded project, because you know what the input costs are on that, because it's, you know, it's in the budget. But working with health particularly, it's actually much more difficult to identify those indirect costs as well as the direct costs, because all of the budgets just sort of sit with someone else and they merge into a big nebulous pot of who knows what. And particularly in NHS land, people find it very difficult to identify actually what the input costs are for a particular support service, because they might be able to identify the staff costs, but they just can't pin down those indirect service costs. So a realistic proportion of all of the things that make that possible, you know, the digital, the marketing, the financial support, the sort of, if you were running a business, the kind of indirect costs in terms of your what actually makes it happen, you know, your management and all of that sort of stuff. Data collection, again, the consistency around that. So some of the things that might make that easier are, we're working to, at the moment, co-design a case study template with a number of partners that we're working with, so that we can try and consistently understand some of the outcomes that we're looking for, that we can definitely link to proxies in the social value engine, so that we can kind of understand what we're looking at there. And we're looking at maybe drawing together a panel, including people with lived experience, to help us moderate that kind of data quality a little bit, and pick up samples of those case study templates, some guidance and shared protocols on, you know, how to collect more qualitative data, but also pull out some of the things that can then be used as measures from that. You know, knowing an outcome when you see one, for example, that kind of thing. And valuing social value, I put that as one of the challenges, just because it's getting that buy-in really from people across the whole programme. So whether that's the team members who are capturing the stories, understanding why and where that's going to be used, but also for system leaders to understand actually how does this data then feed into things like quality improvement programmes, how does it feed into service redesign, and then, you know, making sure that we've got the buy-in at that level as well, so that actually when people are looking at programmes or things like that, they're actually not just looking at, they understand that actually they need to look just beyond the numbers, and that they need to look at actually the difference it's making. And this is just one of the ways that we can kind of bring this to people's attention. I think the value of linking personal outcomes and system outcomes to social value measures is that then the financial figure you get at the end of it is the thing that sometimes opens the doors or raises the eyebrows of people who are used to thinking in a very numbers focused way. So it isn't the be all and end all, but it's sometimes the thing that opens a door and makes people go, ooh, okay, this might be interesting. And then wider work, one of the things that came out of particularly the Living with Cancer programme was that how do we start to capture some of the wider outcomes, not just people's personal outcomes, but actually the bit around, if you support somebody who is a parent and you give them the right support to deal with a long-term health condition, does that have an impact actually on their children and their dependents and their wider family members? Does it mean that people can maybe stay in work? Does it mean that their children have better school attendance because things feel more secure at home? Does it mean that, you know, mental health across the family is improved, for example? Things like that. And then one of the other really key things for us is that active involvement in evaluation activity. So involving people with experience, so not just our workforce, but also people who've been through a service in kind of understanding what the outcomes look like for a particular service. You know, what are those things? What are the differences you're looking for in that service to make it meaningful and measurable and good quality and all of that sort of stuff. So starting with actually, what should it look like? What does good look like? And involving people in that to understand it fully. And that's pretty much me. Just to say that the next step for us really with all of this is exploring how we can use people's stories more, developing some of the tools like a template for capturing holistic case studies. I couldn't think of a picture for that. So that's a picture of it, the draft, not expecting you to read it. I wasn't being very creative when I thought of the picture for that. But it really is just that kind of, you know, how do we develop a template that can then be used to then pick out some of the data in the social value engine and link to some of this so that we can get a social return on investment of some of these wider personal impacts. I'm just going to leave it there and see if anyone has any questions about that. It is a bit whistle stop.
Brilliant.
Stop sharing.
Really, really good, Katie, that you took us on what I might describe as a bit of a deep dive there into actual examples of how you've used the tool. And
Yeah.
There are some purists who say that social value isn't always a great thing to do in relation to looking at the experience of individuals. It's more project and bigger scale intervention focused. But we've been working together on some really engaging and interesting thoughts around individuals and the learning that can come from trying to look at that. And I think there are three things that really add to the lexicon that's emerging through this from your presentation. One is prevention. So, you know, really key agenda in terms of local government, saving money, public sector, building resilience capacity. Second one is partnership. You know, the way that you've been able to really act as an active partner, building on the examples Mark gave as well, particularly within the health system. And then the final one is that people agenda and engaging people as widely as you have. And the case study template is really, really interesting and a bit unusual and different, if I may venture to say so. And again, with Katie's agreement, if there's anybody who'd like to perhaps see that as it emerges, because caring is sharing, as I used to say to my kids a long time ago, we can probably make that available to people. We have got a question from Guy about relative levels of social impact, but I think we'll save that up to the end because he says it's generally for all the presenters rather than specifically targeted at Katie's discussion. So nobody's popped anything else. Oh, hang on a minute. Yes, so we've got from Matthew here. I'm sorry, I'm attempting to badly multitask. Well, we all are. I'm just wondering about the selection of proxies used in social value engine. Were these prescribed from the outset of the project, or was there any flexibility as the work developed to change these? Katie.
Yes, so for us, very much about flexibility. So we started off looking at it very much as a where do we start? So we involved people with the social prescribing example, particularly, we involved social prescribing link workers and people delivering the service to identify the outcomes, first of all, that were most reported. And then from that also to look at the proxies in the engine and work with Ivan and the team to really explore, whittle down a short list of things that we thought, oh, maybe that one, but we don't really understand them. And then we had conversations with Rosary, Jen and the team to arrive at a list that were the sort of, if you like, the best match, the closest match. So there was a lot of that was where the hard work lies, really, for us, isn't it, Ivan? There was a lot of prep work there done before we got to the point of putting any numbers through the engine. It was a lot of what's going to be the right approach, how do we find, and actually finding some other financial proxies. We kind of tasked you with a couple of them, didn't we, and went, well, we can't find one for this, so find us some information and research that will that fit with that, or a little bit more of an indicator that we can use within the engine to kind of demonstrate that. So yes, flexibility, and I would always say, I think we would always review it again each time, and I think there is some learning that came out of the first time we did it, that we would change and we would do things differently next time, and maybe look at more refined proxies for things like accessing new services. For example, we would probably drill down a little bit more and pick out which particular types of service, was it financial support, was it support with physical activity, those kinds of things. So we do a little bit more of a detailed kind of drill down with some of those. So yeah, innovation in a way for me.
Well, we have been on a journey with this. We've got 600 odd proxies. There are zillions out there. And I think it is a question of sitting down and feeling comfortable with the ones you're using, and it is iterative and it does evolve over time. And the people at ACT in Cumbria, they've been hugely inquisitorial in a good way about the proxies we've used, and we've spent hours and hours. We are doing a bit of work at the moment around WellBiz, because that gives a slightly different flavour to the way one works through the whole benefit assessment and monetisation process. And if there's anybody at the very end that would like to just leave their details and perhaps get on that WellBe journey with us. WellBe's aren't new, they've been around for a while, but James, who I'm going to cue in a minute, has developed a prototype WellBe calculator for us, and certainly at the level of individuals and subjective well-being, there's some really interesting stuff we think we can do with people around that. Anyway, that leads me directly on to James. I wouldn't quite call James Stato, although he does quite enjoy listening to Test Match Special, and he's got a real depth of knowledge and expertise around numbers, but also is a really powerful person when it comes to visualizing stuff, and has been an absolutely core part of what we've done, because this can be a bit of a dark art, it can be something, and we're on a mission to try and make sure that as many people as possible engage with this rather than find it difficult or scientific in a way that's unhelpful. So James is a key part of that whole agenda, and I'll hand over to you, James, now to talk about some of the data visualization and mapping we've done.
Thanks, Ivan. One of my thoughts was just to dive straight into one of the dashboards. But Ivan, you got your thumbs up. I had another thought that maybe it'd be worth having just a couple of minutes to try and set the context first. And so I think I win the prize for the simplest slides, because I think I've got about 3 slides here, but let's get these open. Yeah, so I just wanted to talk through what is quite a long and winding journey to how I've ended up, as Ivan was saying, working with these dashboards to present social value information, and I think it's what the heading says there, that for many years I've faced the challenge of trying to get across financial information, numerical information in ways that people understand. And Microsoft Excel, wonderful though it is, doesn't always make that easy, because very often you're trying to pick out the figure in column G, row 72 or whatever it might be, and that is not easy to do, and it's particularly not easy to make comparisons between different figures. So yeah, first, I'm not going to pick out every year from 2007 onwards through to 2025, but just to pick out a couple of years. Back in 2007, I was working for what at the time was called the Big Lottery Fund, now the National Lottery Community Fund. And I'm based in the Northeast, and part of my role was to go out and talk to the local stakeholders, the local bigwigs, councils and local MPs, and explain to them how they were doing from the lottery. And the grant systems at the lottery at the time didn't make your life particularly easy. We had a grants database that it would spit out a CSV file that you could then try and interpret to show that Gateshead, for example, was receiving £2.5 million in the last financial year. But when you're out and about talking to the local bigwigs, it wasn't those total figures that they were most interested in. It was really the comparison. So Gateshead wanted to know how they were doing versus Newcastle. Newcastle wanted to know how they were doing versus North Tyneside, and so on and so forth. And an Excel spreadsheet doesn't, as I was saying, doesn't really make those comparisons very easy to do. But it felt at the time that the tools to do those comparisons, and particularly to do it in a way so you could follow those interests, just weren't there. So scrolling forward a decade or so, I've now left the lottery. I'm working at a valuation and research consultancy firm, and we were tasked to produce a funding ecology report for a whole region, and that was based on 360 giving data and also a survey of different funders in the region. And based on that, we did a lot of analysis, produced a very nice report with GIS maps and tables and charts and so forth. But alongside it, we also produced an Excel dashboard, because Excel had also come on a bit in those last 10 or 11 years. Things such as slicers have been introduced, so you can look at filtered data and interact with some of the data, but it was still based in Excel. So if anybody wanted it, you still had to email it to them, and also it was a bit clunky and a bit slow, because you're trying to adapt Excel to something that it's not particularly naturally suited to do. So the next time we did the report, that's when we start using Google software, a program called Google Looker Studio, to visualize the funding data, and this seemed to work very well. This wasn't social value data. This was funding data about grants awarded, but you could follow those personal paths of interest and dig down and focus in on what was most interesting to you. And I think it was round about this time that I had a conversation with Ivan, and Ivan said this could work really well for social value data. And yeah, so that's been quite a long introduction to say this is the link the dashboard. And one of the challenges with social value data is it's not short of numbers. There's lots and lots of numbers. Part of the challenge is making sure you're getting the most interesting things on the screen. So the way around this that I've developed over the last couple of years alongside Ivan, alongside colleagues at the Social Value Engine, is to break it up into the process that Katie and others have talked about looking at inputs costs, so you can put in a lot of the detail about inputs, then looking at the outcomes, and then combining those two into a social value page. And it might be a stretch to say what the joy of the dashboard is, but there's certainly the big advantage of the dashboard is that you can filter this data in as many ways as you like. For example, you can choose just one of the directorates, and all of the charts will update. So that figure is now £4.56. I can't remember what it was before. £4.57. So minimal impact there. Or you can select one row from a table, or you can select more than one row from the table. And then you can gradually hone in more and more on particular projects of interest. And that, for example, is one of the 4 highlighted projects. And you can see its location on a map. And then sometimes you go down so many paths you can't remember which filters you applied, but you can just reset it all and present information that way. There's similar information on inputs, similar information on outcomes as well, but I'm kind of conscious of the clock, so I'm going to call a halt there. Let's stop the share before I drag that across again.
Brilliant, James. I mean, the thing is that you took us on a bit of a journey there. These things are like wormholes. You can get really sucked into them and pop out into a different data-driven universe. And there are lots and lots of ways that you can use tools like this to visualize data and actually to validate approaches as well. James and I have been working recently on the Scottish CLLD program dashboard, and because each of the dots is proportionate to the scale of impact or cost, or you know, you immediately see if you've got 1 or 2 rogue things that have crept in, because you have the odd massive blob on the map, and it's been very helpful saying, well, how's that occurred, what's gone on there? And so it's a double check. So this visualization piece, we've seen the impact cards, which I know from the chat people liked, that Claire showed, but this sort of online updatable dashboard facility is very powerful as well. And it's worth saying that well, you see, Ryan's brought us straight on to where I was going to go to. So the data has to be assembled via a download from the Social Value Engine by James, but it's very easy to do that. We've got a little piece of bridging programming that's been done, so it's very easy for James to extract the data into the dashboards. And Maddie, who is the organizer of the call, is doing some work at the moment to enable us to look at some templates that would enhance the experience of dashboard development. But what you can do in the engine, and that drives the mapping, is there is a facility to put the postcode in for every project, either its location or its originating organisation. And when you do that, that's what then drives the development of the dashboard that James showed. So it's a very easy process to take the data from the engine and convert it into a dashboard format.
And also it's not like after we've done the download we're adding any new data. It's not and and analysis process. It's all data that's sprung from the social value engine. I'm just kind of manipulating that existing data so it works on the software.
So there we are. So any other questions about James's presentation before I just jump into a brief discussion more widely? Okay, so we've got an email from Alina here responding to Esther's question. And this is one of two questions that we'd got, which were more generic for this part of the discussion. So I'm going to take this one first, and then the second one about relative social values. So I'm sorry we're doing them the wrong way round, Guy, but because this string has just started kind of growing, perhaps if I ask Claire just to explain the response to this in terms of community involvement and getting people to respond to evaluation.
So, I mean, fundamentally, it is Helena and Andrea's team who's on the call who do this. It's partly about people and partly about process. So one of the things we do is that we have identified the outcomes that we expect to be delivered through a programme. And therefore, we ask people within that application process kind of what they expect to do, and then we monitor it through the programme, and they don't get their final chunk of money until they've told us the outcomes that they've achieved. So there's a kind of carrot and stick slight approach in terms of actually kind of monitoring and getting the data that we need. That probably means that we don't capture absolutely everything that people deliver, because we do a lot of it through that kind of pre-defined outcomes stuff, and they might be doing more, but we're not asking them about it. But on a programme such as this, it is the only way of gathering that consistent set of data. We also, the other element of it is about people. So when people are applying to these programs, there's usually a very early stage, very easy expression of interest type form where people say what they're intending to do, and then they get allocated someone to talk to about it. And we can use those interactions to have those conversations about impact and what they're doing and how that works, and then kind of on through it. So when we first did it through CLLD, we had a full-time person who was supporting each and every group with developing their impact story. We can't do that for every programme that we operate, but we do have our team who can kind of go and have those conversations, and we're always kind of trying to gather case studies and the like in terms of getting that qualitative data as well as stuff. Can I just answer Guy's question, because I'm going to have to jump off in a second because I've got something else at 2. But in terms of do we isolate elements that provide greater social value, I think my fundamental answer is no, because social value is absolutely individual to the particular project and the group of people that people are working from and where they're starting and what is valuable to them. So what might appear to be something, the risk is that if you try to isolate variables, what you'd be picking on are the things that are really easy to do. And we don't always want to do easy things. Sometimes we want to do really difficult things, and the level of social value might therefore be less. But in terms of relative value, really, really, really important. So I don't think we'd ever want to use it in that way. Ivan, you're on mute.
Thank you very much, Claire. You know, I owe everybody £10 now, don't I? But unfortunately, there's only 39 left out of the 57 we had. But we've done very well to keep that number of people, and you are excused because Claire has toggled 2 things to be with us. So thank you very much, Claire. I will thank all the other presenters now, because I am determined we finish at 1 o'clock, because that was the promise. there are some really interesting new questions coming into the chat, and I'm happy to follow those up with individuals as well. I have a really interesting question from Sarah about juggling things in terms of CLLD and getting to the nub of some very clear and comparable outcome measurement, because there's a lot of variety in her experience of how the CLLD program has been measured, and also consistency in terms of the use of something that we call deflation, which is how we adjust the gross results to take account of local circumstances. So I'm very happy to have an offline about that, but I'm pleased that you've raised these issues, Sarah, because they are real issues. And if there are only 2 of you in a team and you've got a program of that scale, you know, the systemization process needs to really help you as much as it can. And we're learning and evolving the social value engine as we go on. But if you'd like to, I'm more than happy. Just drop me an email to talk to you in a bit more personal detail about that. But I think that they really are key aspects of using the tool that you know need careful attention. Also, a really interesting email from David Andrew in terms of your PhD research and the idea of finding a fresh, user-friendly way for volunteer-driven and time-poor organisations to better present their impacts. We are doing some work at the moment about a really tailored down managed service that could focus in at considerably lower cost than a licensed subscription, developing a mediated report, which really needs about an hour of commitment. And it won't be a frippish poor quality thing, but we do most of the heavy lifting then, but on a very focused basis, working with individual organisations. So if that's something people would find attractive, we can talk about it. We also have a number of intermediary organisations like Marks and like Cornwall Rural Community Charity who are able to help as intermediaries with some of this stuff, because they've now got the expertise and they can work with people slightly downstream. And I think that's probably us done for now. I said 90 minutes rather than an hour when we were planning this. I get a sense we could have gone on for longer. But I think people's attention spans do wane, and I'm very pleased that 29 people have stayed on this long. And I found it really positive and heartening. If anybody wants a reward in the form of some shortbread or a linen bag or anything else to do with social value engine memorabilia, if you do make your way to Liverpool on the 1st, 2nd or 3rd, to the LGA conference, we'll be there, and we're more than happy to distribute those. But if anybody would like to pick up on any of the issues by email, we're happy to put in some follow-up time. So I would really like again to thank the speakers. I just think back 2 years to when we were running these sort of events and how much this has come on. This whole process has come on, and you know, some really powerful examples here of people really making social value matter and effective. So without further ado, if I could thank you all very much indeed. If you'd like a copy of the recording, we can source that as well, but please do keep in touch, and thank you very much. I'm going to leave now. Thank you.